If you've been struggling with a painful, stiff shoulder that just won't seem to move like it used to, then this video is for you. Today I'm going to talk about frozen shoulder, also known as adhesive capsulitis. I'll explain what it is, why it happens, how it's diagnosed, and most importantly, what you can do about it, including a set of exercises that you can do at home to help get your shoulder moving again. If you're new to the channel, then welcome aboard. I'm Stephen Bunting and I'm a specialist MSK Physiotherapist working in the UK. Here I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. Frozen shoulder is a condition where the shoulder joint becomes painful, stiff and difficult to move, almost like it's stuck or frozen. It happens when the capsule that surrounds the shoulder joint becomes thickened and tight. In a normal shoulder, the capsule is a sleeve of soft tissue that surrounds the shoulder joint and helps keep everything in place. It's usually quite lax and saggy, which allows the huge range of movement available in our shoulders. But in frozen shoulder, this capsule thickens and tightens, almost like shrink wrap. It essentially glues itself down or adheses to the underlying shoulder joint, which is where its official name of adhesive capsulitis comes from. The condition typically goes through 3 distinct stages, and the treatment depends on which stage you're in. So pay attention to this bit because I will be coming back to it later when I talk about the treatment options. So stage 1 of frozen shoulder is called the freezing stage, and the main symptom of this stage is pain. So this is where the shoulder becomes more and more painful, especially when trying to move it. So in this stage, the capsule is angry and inflamed, and the pain can be really severe. Frozen shoulder sounds quite innocuous, doesn't it? But the pain from a raging frozen shoulder in that early freezing stage can be one of the most painful conditions that we see in the MSK world. And it can last from 1 to even 6 months. So it's going to be really painful to move your arm in any direction, and sleep is probably going to be disturbed. Stage 2 is called the frozen stage, and the main symptom of this stage is stiffness. So for most people, this is a major relief because the pain has finally settled down and you can now sleep better, but the stiffness sets in. So in this stage, the inflamed capsule calms down, but it becomes tight and fibrotic, so you're going to struggle to lift your arm away from your body, take it out to the side, or take it behind your back, so things like tucking a shirt in, fastening a bra, or combing your hair are going to be difficult. This is the longest stage and can last an average of 6 to 12 months. And finally, there's stage 3, which is the thawing stage. So now the pain is pretty much gone and the stiffness finally starts to loosen up. This can take an average of 3 months, but in the end, your shoulder should have fully recovered. Although it has to be said that some people never quite get their full movement back again, particularly after a nasty frozen shoulder. They might just lack that end range movement for the long term. So unfortunately, a frozen shoulder can take between 1 and 3 years to go through these 3 stages and get better. But the good news is that most people do get fully better over time. The other bit of good news is that the early freezing stage doesn't last too long in most people, and once that stage is over and you're into the frozen stage, then the pain usually drops right down, and despite the stiffness, most people are now fairly relieved and relatively happy and comfortable. So why does frozen shoulder happen? Well, the truth is we don't fully understand all the reasons, but there are some clear risk factors. It's more common in people aged between 40 and 60. It affects women slightly more than men. People with diabetes or thyroid problems are more likely to get it, particularly poorly controlled diabetes. It can also occur after a shoulder injury or surgery, especially if the shoulder is kept still for a long time. But most commonly, frozen shoulder develops without any obvious cause, which can be really frustrating. But here's the key point. Frozen shoulder is not caused by poor posture, sleeping awkwardly, or lifting something too heavy, so it's usually not your fault. It's a medical condition that can happen to anyone. And there's one other bit of bad news. If you do have a frozen shoulder, then there's about a 20% chance of getting it in the other shoulder within 5 years. But that's an 80% chance that you won't, so fingers crossed. Frozen shoulder is a clinical diagnosis, meaning that in most cases it can be diagnosed based on having the right symptoms and examination findings. Imaging is not usually needed, although I will usually x-ray a frozen shoulder just to rule out any bone or joint abnormality, such as arthritis, fractures, dislocations, and some rarer bone conditions, as these problems can mimic the symptoms of frozen shoulder. The most important clinical feature of a frozen shoulder, though, particularly in the frozen stage, is a lack of external rotation. This is the movement where the shoulder rotates outwards like this. So to check this on you, just tuck your elbows into your sides, bend your elbows to a right angle, and then rotate your shoulders outwards. So you can see here that in the left shoulder, I can fully rotate outwards, and the normal range is between 70 and 90 degrees. But in my right shoulder, it's only rotating out to about 10 degrees. And this is the cardinal sign that you probably have a frozen shoulder, especially if your x-ray is otherwise normal. The other movements that will be stiff are the hand behind back movement and the elevation movement. Right, let's talk about the important bit. What can you do about a frozen shoulder? Well, the main treatments focus on two things: managing pain and then improving movement and strength. So let's go through a step-by-step plan. Before we get started though, I will say that in my practice, once I've explained these 3 stages to my patient and highlighted that frozen shoulder usually gets fully better over time, some patients, especially those with milder symptoms, will be happy to be reassured and allow the passage of time to be their treatment. And if that's you, then you can stop watching now, and that's absolutely fine. Put the problem to the back of your mind and allow nature to take its course. For the rest of you though, and particularly those of you with severe symptoms, stick around and I'll go through the treatments. So if you're in the early freezing stage, then pain is likely to be your main problem. And like I said earlier, it can be really severe. So the simple things you can do immediately is to use pain relief medication and anti-inflammatories if you can take them. But make sure to speak to a prescriber or a pharmacist if you have any doubt. Now, please don't discount the importance of this. Taking a simple painkiller like paracetamol or something with a bit of codeine like cocodamol, combined with an anti-inflammatory drug like ibuprofen or naproxen, can be really helpful. But you must, and I need to stress this, you must take them at maximum dose and at the right time. So if it says 2 tablets every 4 hours on the packet, then that's exactly what you must do. The main reason why painkillers don't work as expected for most people is because they take them infrequently, as and when needed. So the therapeutic effect never gets a chance to build up and be maintained. So that's a really important point. Take your pain meds regularly. The next simple thing to try for yourself is using ice or heat. For most people, heat will help, but occasionally I see people who get better pain relief from using an ice pack. So try each and see for yourself. There's no right or wrong in frozen shoulder. And the last pain relief option is a cortisone injection. And indeed, if your pain is severe and disturbing sleep, then an injection is going to be your best option. It can really put the fire out in an angry frozen shoulder. It's not going to help with the stiffness much, but for pain it can be really effective, and I will offer one quickly to most of my patients with a painful frozen shoulder, especially if sleep is being disturbed, which is a horrible situation to be in. So don't suffer needlessly. A cortisone shot can really help. Now, if you have the option of getting this done under ultrasound guidance, then that's usually better for accuracy, especially if the shoulder is also very stiff, because the needle has to get underneath the capsule, which often gets tight and stuck down as the condition progresses. And indeed, if you've had an unguided injection that hasn't helped, then it's probably because the needle didn't quite get underneath the capsule and into the joint cavity. Once the pain is under control and the condition is moving into the frozen stage, then the emphasis for treatment starts to shift towards maintaining and then improving your shoulder movement and strength. And this is done by doing regular stretches and exercises, because the research is clear here. Movement is medicine, but you have to start slowly and not push into pain too aggressively. So try and keep any pain below about 4 or 5 out of 10 on a pain scale like this. Okay, so let me show you a simple set of frozen shoulder exercises. These are safe to do at home and are designed to gently stretch and then strengthen your shoulder. For the purpose of this video, my right shoulder is the affected shoulder for all of these exercises. So these first exercises are gentle mobility exercises and are great for the painful early freezing stage. This first one is the pendular swing. This is a great exercise for moving your shoulder in the most painless way possible. So it's a great first exercise. Use a chair for support and then lean slightly forwards to create a space so you can gently swing your affected arm like the pendulum of a clock. There is no effort here. It's not a stiff, rigid movement. It's a nice, relaxed, pendular movement. So start by swinging forward and back like this. And then to progress, you can just hold for a second in the high positions like this. You can also do the same exercise, but in the side-to-side movement like this. If you're struggling to relax and get that smooth pendular action, then try using a small weight. I'm using a 1 kilogram dumbbell here, but you could also use a 1 litre bottle of water or a 1 kilogram packet of sugar. Next up is assisted elevation. So these exercises basically use your good arm to help lift your affected arm as high as you can with minimal pain. So I'm basically grasping my hands together and lifting them upwards and forwards as far as I can. You might only be able to lift your arms up a little bit, and that's fine. Just go as high as you can without causing pain. Another way of doing the same thing is to use a broom handle or a golf club. I'm using a walking stick here, and I'm just doing the same thing, slowly and carefully, and using the strength of my good arm to help lift up my frozen shoulder. A set of pulleys is another great way to achieve maximum shoulder elevation with minimal pain. I got this set off Amazon for under £10, and I'll put a link in the description. So it hooks over the top of a door, and as you pull down with your good arm, your affected arm essentially gets a free ride upwards. You can control the amount of shoulder movement very precisely with this exercise, and so it feels very safe and secure. You can also turn side on to the pulley like this and move your arm out to the side. So this is great for the painful freezing stage, but can also give a more intensive stretch in the later frozen stage, so it's a really versatile exercise. The next gentle stretch addresses the external rotation movement, which is always stiff in frozen shoulder. So I've got my elbows bent to 90 degrees and tucked into my sides. Grabbing a stick, I'm using my left hand to push into my right palm and push the hand out to the side, stretching my right shoulder. Make sure you keep your right elbow tucked in all the time, as this makes sure you're doing a true rotation movement. Hold the end stretch position for a few seconds each time. And the last of these early basic exercises is the table slide. So use a raised surface like a table or a kitchen top. Put your hand on a cloth or something that will slide easily over the surface, and then practice sliding your hand forwards and back and side to side, and then in circular movements. To progress, just stand a bit further away from the tabletop. Okay, so this next set of exercises are more suited for the frozen stage, where pain is not so much of a problem, but stiffness is the main issue. And the first of these are the wall walks. So in its most basic form, you're simply walking your fingers up the wall as high as you can, pausing for a second, and then slowly sliding your hand back down. If this feels too easy, then there are a number of different progressions with this exercise. The first would be to just slide your hand from side to side when in the highest position. After that, you could tilt your upper body forwards like this, which will add an extra stretch to your shoulder. You could then do a little press up in the highest position. And then do the same with your hands further apart. The next set of these more intensive stretches are for external rotation. So these use a door frame to essentially lever your shoulder into rotation. I'm using the door itself here, propped open with a wedge, just because you can see a bit better from this angle, but for you the door frame will be more sturdy. So like the other external rotation stretches, you have your elbow at 90 degrees and tucked into your side. You then place your open palm against the door frame and then slowly turn your whole body outwards while your hand and arm stay in the same position. Go as far as you can to get a good stretch while respecting pain, and then hold for a few seconds. To progress, take your whole arm into elevation. I'm grabbing the top of the door here, and then do the same outwards turn with your body. These stretches can be quite aggressive, so go easy to start with. And the last of these stretches is for the hand behind back movement. This is often quite stiff and painful, so go easy at first. So here, I'm just taking my hand as far behind my back as I can and then giving a little extra pull with the hand of my good arm. A progression to this is to use a bath towel like this to pull your hand further up your back. This last set of exercises are to be used when the shoulder starts to move into the thawing stage. Your pain has pretty much gone, your movements are improving, and you now want to get some strength back. So the first of these is that external rotation movement that you're going to be familiar with by now. But this time we're going to use some resistance band to generate some tension and muscle activity. It's best to do both shoulders together, as you can easily judge the strength of one side compared to the other. The next one is similar to the wall slides we did earlier, but this time in the highest position you're going to take your hand off the wall and just hold it there for 5 to 10 seconds. You can also do this with a small weight, like a litre bottle of water, or a 1 kilogram dumbbell like I'm using here. And the last strengthening exercise is the wall press up. So start just like this, and as you get a bit stronger you can move further away from the wall. Or you can progress to a table, or even a full press-up position if you like. The other variation of this exercise are the wall falls. So here, you fall towards the wall, catch your fall with your hands, and then push yourself quickly back up into the starting position. To progress, move further from the wall, and then just try using one arm. Or you could use a table or a work surface of this height, so you have further to fall. Okay, so that's the exercises. You don't need to do them all, just pick 3 or 4 that are suitable for your stage of frozen shoulder, whether that's the freezing, frozen or thawing stage. Start with about 5 or 10 minutes per day, 3 to 4 times a week, and then gradually increase them. Don't worry if it feels stiff, this is normal, but if it's very painful then ease off and focus on the pain relief strategies first. While you're in the frozen stage, progress might seem very slow or even static, but keep at it, as at the very least you will be stopping it from getting worse, and eventually, once you get into that final thawing stage, your shoulder movement should start to improve and you can then focus more on the strengthening exercises. In severe cases of frozen shoulder, where the pain and stiffness just won't settle despite trying all the treatments we've discussed, then there are a few interventional options that a specialist can provide that might help. So this might be either someone who is stuck in the freezing stage and is still in severe pain that's showing no signs of improvement after 3 to 6 months, or someone who is stuck in the frozen stage who still has a very stiff shoulder that hasn't thawed after about 3 years. So the first thing that might be tried is a procedure called hydrodistension. So this is a specialised procedure where a needle is placed under the joint capsule using ultrasound guidance, and then a large volume of fluid, usually a mixture of local anaesthetic and some sterile water, is injected under pressure into the shoulder joint, with the intention of trying to stretch the capsule from the inside outwards. It doesn't work for everyone, but I've had some great results from using this procedure, and it's minimally invasive with very few side effects and complications, so it's often worth a try. If it doesn't work, then the only remaining option is going to be surgery. So a surgeon can carefully cut away at the tight capsule in an effort to free the shoulder off and restore movement. It's a procedure called a capsular release, or it's sometimes called a rotator interval release, and it's done as a keyhole procedure, usually under general anaesthetic. Historically, a procedure called a manipulation under anaesthetic, or MUA, was once used to achieve the same thing. This involved putting the patient to sleep and then literally wrenching their shoulder into the stiff positions, essentially tearing the tight capsule. But we've since learned that while this might tear the capsule, it can also tear some of the other structures in the shoulder that you don't want tearing, like the rotator cuff tendons, which can then cause further problems in the future. So an MUA is really not advisable in modern healthcare, and I wouldn't recommend it. Before we wind things up, I just need to mention diabetes, because a diabetic frozen shoulder can be a real problem and can often take twice as long to get better compared to a non-diabetic frozen shoulder. And the symptoms and your length of recovery will be worse the poorer your diabetic control is. Indeed, if your HbA1c blood test is consistently over about 80, then you need to urgently prioritise your diabetic control over every other treatment, because it's the high circulating blood sugars that will be driving the condition, and unless you do something about this, nothing else is going to help much, including all of the treatments that I've discussed. And those interventional treatments won't be offered because they just won't work. So it's really, really important to get your diabetes under good control. Okay, so to wrap up, frozen shoulder is a self-limiting condition, which means it gets better over time in the majority of cases, but you can help it along by staying as active as you can. Don't push through severe pain though, but don't avoid using your shoulder altogether. Keep it moving within your pain tolerance, but do get help if pain is a real issue. An injection can give great pain relief. And be patient. It's a slow process, but the exercises I've shown you today will make a real difference if you do them consistently. And if your pain and stiffness aren't improving as expected, or if you're really struggling to cope, then do see a healthcare professional. Options like physiotherapy, injections, or even surgery might be an option. Okay, well that's about it. If you found the video helpful, then please give it a like, leave a comment, and share it with anybody else you think might benefit. Well, thanks very much for watching, take care, and until the next one, bye for now.